webinar for care coordinators and facilitators, brought to you in partnership by Portland State University and their training partners, the Oregon Family Support Network, Youth Move Oregon, and our funding partner, the Oregon Health Authority, for the statewide Children's Systems of Care and Wraparound Initiative. My name is Dan Embree, and I'm Assistant Director here at the Systems of Care Institute at the Center for Improvement of Child and Family Services in the School of Social Work at Portland State University. I want to thank and welcome everybody for attending. We have attendees registered from all over the state of Oregon in the 16 CCO regions and 33 counties. So it's exciting to see those of you who are participating today, and thank you for attending. Part of what we're going to go through today is learning about what is wraparound coaching and how is that different from supervision. We're also going to talk about what are we really trying to accomplish. What is wraparound coaching for? Also the types of it and the roles that are involved in a wraparound coach. Some of the things we're focusing on here in Oregon, and really getting an understanding of what we're trying to do related to quality and fidelity. And then we'll talk about next steps for your own community to further this learning process and develop the capacity for wraparound coaching in your particular area with your site lead and training lead and the partners who will design something with you to continue that learning. So that's kind of what we want to accomplish today. We're going to go till around 3 o'clock, and I want to make sure, though, that we leave plenty of time for discussion and questions at the end. So we'll be continuing to monitor the time and make sure that we've left enough space for that to be done. If you are having any problems technically, you can always email or send a written message to the organizer, and they may be able to help you with that. Okay? So I wanted to start with, what are we trying to do? So there's this wraparound coaching and supervision, but really it's linked to something larger than that. And so we need to first understand, when we talk about wraparound coaching, is why? What is it all for? What are we trying to do? And the answer to that is wraparound coaching is a crucial piece to develop quality and fidelity wraparound in your community. So what we're trying to do is one step in the process of creating that quality wraparound that's implemented with fidelity. And I want to talk a little bit about what that means before we delve into how we're going to go about doing that. The definition of quality says that it's the standard of something as measured against other things of a similar kind, or the degree of excellence or value, and how good or bad something is perceived to be. So what we're trying to do is we're trying to develop a quality wraparound process in the state of Oregon that has a degree of excellence or value, and we'll talk a little bit more about that in a moment. And then the second thing that we're trying to do, or what we need to define, is fidelity. And fidelity is the degree of exactness with which something is copied, replicated, or reproduced. The state of being faithful to something, or accuracy in details. So that's the definition of quality and fidelity, what we're trying to do. But what is wraparound quality, and what is wraparound fidelity? So we have to have a clear picture of what that means, because that's what we're going to be supervising to and coaching to and trying to develop around the state of Oregon. First of all, wraparound quality. One way to define that or think about that is we're trying to create a care planning, care coordination, care management process that most consistently produces the desired outcomes for families, for youth, system partners, providers, and stakeholders. So quality wraparound would be a care coordination and care management process that is the most consistently producing outcomes that are positive for families and youth. We want the highest quality of wraparound possible for our youth, families, system partners, providers, and stakeholders. Now, because in Oregon we're doing that through a systems of care lens, there's lots of things to think about when we think about quality. It's not only about how wraparound defines quality, but how do we define that in Oregon? How do we define quality wraparound in Oregon? How will families and youth define wraparound quality? What's important to providers and community members in thinking about quality? What will leaders and managers be paying attention to in their own communities about what's important to them? And finally, what's important to system partners? Wraparound isn't just meant to be a mental health project, but it's meant to advance the needs or get the needs met of all system partners that family and youth are involved in. And so we have to think about this as quality for the whole system and how we define that. The other is, what is wraparound fidelity? And so as we look at the quality, meaning the high degree of success and outcomes, meeting that of the family, fidelity is the degree to which the principles, phases, activities, and core elements of wraparound are implemented as intended. So fidelity is different from quality because fidelity looks at, is it being implemented as intended? And we've chosen our intention of implementation as that which is defined by the National Wraparound Initiative and the Oregon Wraparound Best Practice Guidelines. And you can find a copy of both of those things on both the NWI website and the DHS and PSU website. So that brings us to the wraparound and fidelity question. Or I'm sorry, the quality and fidelity question. How are we going to know if we are consistently doing what we say we are doing and consistently producing the desired outcomes? Now, wraparound coaching and coaching tools is one crucial piece in us building that consistency of quality and fidelity across the state. We have things like the Oregon Best Practice Guidelines. We have things like the intensive 4-day wraparound training and all of the trainings provided by the partners. The Wraparound Fidelity Index EZ and the team observation measure, as well as the CANs. And then one crucial piece in the quality and fidelity question is the wraparound, consistent quality wraparound coaching and the tools used to support the work within systems and agencies. So as you can see, the Oregon Best Practice Guidelines is one tool. The training that happens, both the 4-day and subsequent trainings geared directly toward your community through OFSN and Youth Move, Oregon Health Authority, Mental Health, and Portland State. All of that training, coupled with the team observation measure, consistent coaching and coaching tools, will lead to high fidelity wraparound in Oregon and improved quality. And we're going to measure our fidelity by the Wraparound Fidelity Index, EZ, and we are going to measure quality by the use of CANs and CAN scores. So we're hoping by implementing wraparound in a strategic manner across the state, we will see high fidelity scores and also high quality scores. That CAN scores, or the Child and Adolescent Needs and Strengths Assessment scores, continue to improve in for the lives of youth and family. So as we begin to think about coaching, I want to talk a little bit about where coaching fits in. This grid is from the document Training, Coaching, and Supervision Guidelines from the National Wraparound Initiative, and you can find that again on their site, and there's a citation there on the bottom. But phase 1 of Training, Coaching, and Supervision Guidelines, phase 1 is about orientation and training. And so this is when folks go through their orientation phase or think about coordinators and facilitators going to the 4-day training, go to follow-up trainings, orientation, site-specific things. And that's phase 1. And phase 2 is the apprenticeship phase, and this is where coaching begins. both coaching by observation, and we'll talk about the different coaching that happens. Coaching is meant to be a follow-up from training to reinforce what's learned during the training process in the real world. And so during that phase 2, or the apprenticeship phase, that coaching begins in an intensive way, which we'll talk about the recommendations for Oregon specifically. And then it also continues ongoing coaching that's informed by real-time needs and strengths of the facilitators and coordinators in each community. So it'll be ongoing and guided by that. So we'll talk about the different levels and where and how to do coaching at those different places. But one thing we need to talk about first is what is supervision and how is coaching different? So what is this coaching thing? And I think it's important to first start with what I think most of us have the most experience with receiving, perhaps the most training around, and probably spend most of our time doing, and that is supervision. So what is supervision? In traditional supervision, or what's oftentimes called clinical supervision, you have a clinical supervisor and then you have a clinician, a therapist, who works directly with a client, patient, which can be an entire family. And in that clinical supervision, or what traditional supervision focuses on, is the patient's behavior and their response to the treatment or process. So oftentimes, a clinical supervisor indirectly affects the outcomes of the clinician-client relationship by focusing on treatment modalities, therapeutic intervention, clinical skills, decision-making, and also maybe points to specific directives or things that the clinician can try to get a different response or behavior from the patient or client. It's also important to note that oftentimes traditional supervision has a large role in agency-specific functions, whether it be corrective action or discipline or meetings, or doing the things and keeping track of what each individual worker is doing from an agency function standpoint. And this is very different from wraparound coaching, and so I wanted to make sure that supervision is distinguished between or distinguished from coaching. So I want to talk a little bit about how coaching is different. Wraparound coaching, first of all, the landscape changes because we have a care coordinator now who isn't necessarily a specifically focused on one treatment modality like a therapist or a clinician would, but a care coordinator or a facilitator. And in coaching, they are assigned a wraparound coach. And in wraparound, the end result or the client or patient becomes a wraparound team. And that wraparound team is comprised of a family and youth. It's also comprised of lots of other providers, system partners, and friends and community members. And what makes coaching different is that the wraparound coach is focused not on patient behavior or family and youth behavior and their response to treatment, but they're focused on working with the care coordinator or wraparound facilitator on what is quality wraparound process, and are we producing high fidelity and high quality wraparound by what we're doing. And so the wraparound coach focuses on how are things going from a wraparound principles lens. How is the care coordinator developing in their facilitation skills? How are they working with youth and family through the phases and activities of the wraparound process? How are they doing with building consensus and problem solving on teams or team stages like forming, storming, norming, performing, or team processes? And it's important to note that in wraparound, the wraparound team is the focus of accountability for decision making. So it's important that the wraparound coach not be a team member, does not make team decisions, but helps the care coordinator focus on how their role in the process can improve the wraparound process for the individualized needs that happen for every youth and family. So in summation, the supervision focuses around clinical oversight around the youth and families' response to treatment or interventions. And wraparound coaching really focuses on the quality and fidelity of the care coordinator's role in the wraparound process and how they're leading the team to make the best decisions. A couple more things about wraparound coaching. Wraparound coaching models the wraparound process in its delivery. So it's meant to be strength-based. It's meant to focus on needs and strengths, and that of the facilitator. It creates an indirect impact on decisions. So wraparound coaching honors the fact that they're not making decisions for the team through the care coordinator, but improves the care coordinator's ability to manage a team so that they make really, really good decisions. They're also focused on team process and facilitation skills versus clinical expertise. Honor that team-based decision making. They're directed by principles of wraparound and systems of care. They're grounded in the strengths perspective, and the process includes coordinators and facilitators, but also is done in partnership with family partners and youth partners on a coaching team. So why do we do coaching? Research tells us that training combined with coaching create conditions in which quality implementation happens. And they are both important components to achieve positive outcomes. So really, training without coaching lends itself to less quality implementation factors. Or training without coaching, some of the things introduced in training then do not continue in the real world because there hasn't been coaching focused on continuing the skills and advancing the skills to mastery of what was introduced to the workers in their training. It advances learning, proactive behavioral instruction for staff in the field, an office that reinforces what is learned in training. Supports an individual while they are achieving their individual goals. So it's meant to be individualized to, whereas a training is for a group often. Coaching is meant to support an individual in their achievement of what they need to work on related to being the best wraparound coordinator and facilitator possible. Adds value in real life situations rather than learning about things hypothetically. We're allowed to learn about them in real life and also get real-time feedback about what's happening to us every month or every week as we learn our skills related to coaching. So effective coaching is something that coordinators and facilitators in your communities will receive on a regular basis. It's linked to the practice. Models wraparound by being a supportive and engaging process, not a punitive and negative one. Proactive, reflective, individualized, and strength-based. So that's some of the reasons why we do coaching. What is coaching? How is it different from supervision? And what makes a good coaching process? I want to now move into the 3 types of coaching. There are 3 types of coaching that you'll need to think about building capacity at the local level as part of your implementation of wraparound quality and fidelity. Those 3 types are group coaching, one-on-one coaching, and in vivo coaching. I'll go through all of those. The first one is group coaching. And this is particularly when a group of facilitators or coordinators within an agency or system come together and meet on a regular basis and receive coaching together. And there's oftentimes group discussion or a specific topic that's chosen or a core element that they want to deepen their understanding about. And so it has a introduction of a concept or a reintroduction of a concept from training, and then includes a discussion of everybody at the table, and can also include some role plays or kind of experimental skill building exercises, whatever people need to advance their understanding of a particular skill. And oftentimes those are done with facilitators and care coordinators in a group process with family and youth partners present, so that the entire group can hear others' experiences, relate them to what they're experiencing in the wraparound process, and hear about how people are responding to that. So that's coaching done within groups. The second type of coaching is one-on-one coaching, and that's done with a particular facilitator or wraparound coordinator who meets with a coach regularly to assess their strengths and needs related to their wraparound facilitation work. And they receive feedback and support around skill sets and tools. And this often includes an initial meeting of a baseline assessment and really self-assessment of how are you doing with the phases and activities of the wraparound process. How are you doing? How do you feel about the different elements of facilitation of a team meeting and things like that? And they get specific coaching then, or get on a coaching plan about how they plan to advance those skills together. Usually one-on-one coaching sessions end with a specific plan of an agreed-on timeline to check in about progress, and then choose topics for subsequent coaching sessions. So that's done one-on-one with a particular facilitator and a qualified wraparound coach. And oftentimes, a family partner can come into that and about if is about a specific team, and also be part of that coaching process as needed, but not always. The third type of coaching is in vivo coaching, and this is the coaching mechanism that's about observation of direct practice. So those of you who have already implemented the TOM, Team Observation Measure, would be one way of in vivo coaching, where the coach observes a coordinator in practice and evaluates their skill based on their knowledge and expertise with a specific tool or a specific targeted skill that a coordinator wants coaching around. So it could be observing a team meeting, it could be observing an initial meeting with the family and youth in their home and observing, and it could also mean observing somebody in their meeting with community partners or system partners around the wraparound process. But it's not just observation. There's three phases to it. One, defining the area of focus for the observation and actually doing the observation. And then there's some period of post-processing that includes observations, recommendation, and maybe even future training based on the experience. So that last section is both observing and then meeting with them one-on-one for processing. So those are the three types of wraparound coaching that we know to be effective for implementation of wraparound in communities. The next thing that I want to cover is, so who is a qualified wraparound coach? Who in the communities in Oregon should be doing this work, and how are they going to become or can become qualified wraparound coaches? Oregon is not at this point moving toward a certification process for qualified wraparound coaches, but there are certain things that a qualified wraparound coach needs to have. And I want to re-emphasize this is really important, that a supervisor has the ability to be a qualified wraparound coach, but not all supervisors for wraparound teams are qualified wraparound coach. So in some communities, the supervisor is the wraparound coach as well, and in some communities, it is a specific role. So there is a supervisor and a qualified wraparound coach both working with teams. And that can be individualized within your community depending on your needs and what you have available in your community. But I wanted to talk a little bit about what a qualified wraparound coach is. First of all, they need to not only have the desire to, but they need to have the skills to help others in their learning and transfer their own skills to other people. So they have to have the ability to do that. They also need to have some proficiency in wraparound, the core elements, both the principles, phases, and activities, how to facilitate a team, and be proficient in the Oregon Wraparound Best Practices Guidelines. How do we do wraparound to the Oregon Best Practices way? They should have experience being a facilitator and care coordinator. They should, in that process, have received coaching from a wraparound coach. And they also need support from their agency or supervisor or system recommending that they be a coach. They should have support from their agency as being somebody who's able to do that function. And also there's a newly formed Oregon Wraparound Content Knowledge Assessment or test. They should be able to pass that test with the core passing score of the core elements of wraparound so that they're knowledgeable in that way. They also should have attended the 4-day intensive wraparound training that's based on the Oregon model and attended other trainings by the partners at PSU, OXN, and Youth Move. They should have attended an introduction to wraparound coaching and supervision training, as well as the advanced coaching and supervision training, which we'll talk about soon. They should be a certified CANS rater and have attended CANS training and be proficient in the CANS, and also experience with the Oregon team observation measure. So those are some things that create a qualified wraparound coach. Maybe people in your community will not have all 13 of those, but they'll certainly have a combination of lots of experience, which may make up for some of the others, and then we can have an individualized plan to help them achieve some of the other things. So a qualified wraparound coach, some of what they will, once they are a qualified wraparound coach, I want to talk a little bit about what they would actually be doing, their roles and responsibilities are. One is related to knowing what quality wraparound is. So coaches demonstrate the ability to define necessary activities of wraparound and the systems of care values and see things through that wraparound systems of care values lens. Ability to link what happens in wraparound and the activities of wraparound with the principles and help people learn how the principles are a guide to practice. The ability to generalize across multiple situations. So when each individual family and youth in a coaching session to be able to generalize across multiple families, what does wraparound tell us we should be focusing on? And a strict adherence to principles-driven decision-making. That we're not going to talk about what each of us maybe would do, but strict adherence to what are the values and principles of wraparound tell us to do and how do we make decisions. They should also, so not only knowing what quality wraparound is, but recognizing what creates quality wraparound. And be able to move away from that expert staffing model and move the focus from how a family and youth behave in the process to the staff following the process with families. So how are we delivering the wraparound process with youth and families in a reliable way and helping staff to find quality process, not just family behavior, but focusing on how are we doing in our knowledge and skill of the wraparound process and delivering that in a consistent way. Second part is then communicating that. So knowing is different than communicating, and coaches have the ability to communicate quality wraparound to many audiences about how wraparound happens, why it should happen, who's involved in wraparound and why, and when, the phases, activities, and timing of wraparound events. And then also helping others adapt and innovate. So we don't just do wraparound, but we do wraparound to benefit families and youth. And so helping people understand how do they stick to the core elements but still individualize. Create capacity for adaptation while adhering to the core practice integrity. So one thing that I often hear is that this quality and fidelity thing creates a lack of creativity in individualized work. But quality doesn't mean uniformity without innovation. It means innovation with reliability to and integrity. So how do we innovate and be creative with each youth and family and individualize our work with each youth and family while still maintaining the integrity to the process and fidelity to wraparound? So how often does coaching happen? Oregon coaching recommendations, and if you think about that grid of training to coaching, thinking about moving someone through the orientation phase to the apprentice phase to the ongoing learning phase, a wraparound care coordinator in a 12-month period or during their first 12 months of work in wraparound, it's recommended that they receive 8 to 10 group coaching sessions with a qualified wraparound coach, 10 to 15 one-on-one coaching sessions, and then 4 to 6 in vivo coaching sessions where they're actually observed doing specific wraparound skills in the environment. And so we're going to talk about what's coming up next. And there's a lot of tools that we're going to learn here in Oregon, coaching tools, for you to utilize to do group one-on-one and in vivo coaching sessions. And there's a document being produced. Some of you already have the latest version of the Oregon coaching supervision tools. There are 13 tools. The first 5 are done in the initial, many are done in the initial coaching session and or the training session with the apprentice. And then there's lots of tools, 8 specifically, that are used ongoing and with everyone as needed. And so the next steps for Oregon specifically will be to develop a specific plan for you and your community through your CCO or region or network to develop a capacity for coaching. So this is not something that's going to be solved today or tomorrow, or we're going to have a qualified wraparound coaches in all of Oregon, but something to get on a developmental process. And so there's going to be specific plans developed through your site lead and state from PSU and your state lead from mental health, the state, who will work with you to begin to think about building your own coaching capacity. The second thing that's going to happen is there's going to be an advanced regional supervision and coaching training. So part 2 of this, some regions have already scheduled this, some aren't ready at this point, so everyone's individualized. But what that training will do is to teach specific coaches and supervisors the coaching tools to be used so that they're proficient in becoming a qualified wraparound coach. So those are some of the next steps. But I want to emphasize that there's not going to be one plan that's the same for all CCOs or all regions, that this will be a specific process that'll be over a period of the next year or so, developing coaching capacity for your community. I also want to emphasize the fact that your PSU lead trainer has the ability to do group coaching, one-on-one coaching, and in vivo coaching for you as a step in the process of seeing what that looks like in your community. So it's not only about building your own capacity, but until your capacity in your community is built to how you want that to be, your site, your training lead and site lead have an ability to participate in coaching activities with you and model some of that process. So what, as far as the next steps, is your responsibility is to set a time with your site lead and training lead and probably your state person to develop a training or develop a coaching capacity for your community and get some of those plans worked out about how this is going to look in your community. And then also, the second step would be then to identify those that are potential or are coaches and can attend the regional supervision and coaching training and get one of those scheduled in your area. So those are the next steps for you. We have left plenty of time for questions. And so if there are any, please raise your hand if you would like to be identified. Otherwise, we have time, extra time, and we can end early. So again, thank you for attending the webinar. This is Dan Embree from Portland State University. And in order to be recognized for your questions, please click the raise hand button